Good morning. My name is Callie Rhodes.
I'm Jacoya Balding.
I'm Emily Martin.
I'm Ashlyn Tyler.
And I'm Elise McGrady, and we are the public health team from Silicotta High School.
What is an opioid? Opioids are a wide variety of substances that range from prescription painkillers to synthetics such as fentanyl and heroin. Opioid addiction isn't a new problem, and at the rate today's society is going, it's one that doesn't seem to be going anywhere. In fact, the first recorded opioid usage dates all the way back to 3500 BC with the cultivation of the opium poppy plant in ancient Mesopotamia. Fast forward a couple of centuries to 1620, and opium arrives in the U.S. for the very first time aboard the Mayflower in the form of an alcoholic substance used for painkillers. Continue to the 19th century, and Civil War soldiers are becoming addicted to their opium-infused morphine painkillers. During the 1960s and 70s, heroin usage is at an all-time high due to Vietnam War veterans being introduced to it overseas and bringing it home with them. In today's time, people are becoming addicted to opioids at an alarming rate, and they aren't exactly very hard to access at all. As you can see, opioids have been rapidly increasing in popularity since basically the beginning of time, and they don't seem to be slowing down anytime soon.
There are around 100 million people in the U.S. who suffer from chronic pain. Opioid pain relievers are commonly prescribed to treat injuries, back pain, even dental pain. Opioids are narcotic drugs that act as depressants of the central nervous system. Humans have receptor sites in the brain that the opioids bind to, especially the opioids heroin and morphine. These are two commonly prescribed opioids. These narcotics mimic the natural pain-relieving chemicals. The opioids block the perception of pain and cause well-being feelings. The side effects are nausea, confusion, drowsiness, and euphoria. People who have developed a tolerance for the medications require increased dosages to experience the same pain-relieving effects and decrease the chances of withdrawal. The addiction, overuse, and overdose has to be stopped.
In order to stop opioid abuse, we must first be able to catch the signs and symptoms before it is too late. Noticing even seemingly minute details such as small pupils or slurred speech is crucial in pinpointing an opioid abuser. Opioids can have a prominent emotional effect on people, causing them to display a wide range of behaviors such as isolation, speaking nonsense, erratic mood swings, and more. It is incredibly important for opioid users to know that effective treatment is available and can come in the forms of detoxification, medicine discontinuation, support programs, and more. If we can help find victims of opioid abuse, we can help end their addiction to such a fatal drug.
People who abuse opioids are not the only ones who are affected. Their friends and families are also being affected. The opioid epidemic is very serious and changes the lives of everyone involved. The U.S. Department of Health and Human Services are working tirelessly to prevent the opioid epidemic from growing and becoming worse. There are certain steps that can be taken to prevent the opioid epidemic from spreading. Improving access to treatment and gathering more research on pain and addiction. Improving better practices for pain management is also a way to help the opioid crisis. Patients can choose alternate ways to help with their pain management, and it can stop the risk of addiction.
In the 1990s, pharmaceutical companies assured the medical community that patients would not become addicted to opioids. Sadly, this was a very false statement. Not only were the doctors and patients misinformed, the physicians began to prescribe them at greater rates. This led to the misuse of these medications that are highly addictive. Today, doctors are much more informed and prepared about the effects of opioids and take more precautions to avoid them. Although we are more informed of the misuse of opioids, addiction continues to increase. In 2017, there were more than 47,000 Americans that died as a result of opioid overdose. That's 130 people a day alone in America. There needs to be a stop.